sharing a bit about their work and telling us a bit more about themselves. And we're just going to go into a discussion on Black in cardio, not on Black in cardio, on diabetes today. So just a bit of information for those who are listening about diabetes. We know that nearly 500 million of people are now currently living with diabetes in this world. And this is just set to increase as time goes on. And that diabetes is the leading cause of death worldwide. And so we know that it's so important to have these discussions, especially to have Black workers, Black researchers on the screen right now, able to share some information and some insight for those watching. So good evening for those who are in the UK. I'm in the UK, so I'm going to start with saying good evening, but also good afternoon and good morning for those across the world who are listening from the various different places. So I actually want to kick off by introducing some of the people here. And I'm going to ask you guys to introduce yourself. I'll start with Gabrielle. Gabrielle, can you tell us a bit about yourself? Tell us about you.
Great. Hi, everyone. I am Gabrielle Jenkins. I am a doctoral candidate in the Department of Epidemiology at the University of North Carolina, Chapel Hill. My research focuses broadly on cardiometabolic diseases, specifically a lot around obesity, physical activity, and sedentary behaviors, and more specifically, cardiometabolic disease over the life course and prevention of cardiometabolic diseases through health behavior, such as physical activity and reduction of sedentary behavior. So I'm happy to chat with you all today.
Nice. Thank you very, very much, Gabrielle. Over to you, Tiffany. Tiffany, tell us about you and what you do.
Hi, everyone. Thanks so much for inviting me to be on this panel. I'm currently a fifth year PhD student at Vanderbilt University in Nashville, here in Tennessee. And I work on a broad base of things around diabetes and kind of more on the molecular side of things. Biological landscape and structures in the pancreas. Looks at glucose homeostasis. So how does the body regulate that glucose as well?
Nice, thank you very much, Tiffany. And last but not least, we have Sarah here. Can you tell us a bit about yourself?
Can you hear me?
Yes, yeah? Could hear you.
Hi, everyone. My name is Sarah Kakulena Mpeda. I'm from Uganda originally, but I grew up in Belgium, which is where I currently am. And I'm currently following my research master's degree in psychology with a focus in neuroscience. And my thesis is to do with the effects of acute hyperglycemia in type 1 diabetes, resulting in cognitive impairment. And my focus is spatial working memory. And I'm 25 years old.
Nice. So as you can see, we've got a broad spectrum of work going on just on the screen right here. And actually, that's going to lead me on to my next question. So what is it that stimulated your passion for diabetes research? And Sarah, you have a unique route actually towards getting to diabetes research. Can you actually answer that for me? What interested you? What stimulated this interest of yours?
Well, first I have a growing interest in all things to do with the brain, neuroscience, but it's more so a personal interest. I actually suffer from type 1. So it stems from my own experience. I had a lot of questions for my endocrinologist, both when I was younger and my current one, and they didn't have answers for my questions. So I ventured out to take up a research master's and formulate my research in the area because I wanted to see essentially how diabetes affects the brain, both short-term and long-term. So that was my reason.
Nice. Thank you for sharing that and being very honest with us as well. Gabrielle, what about you? What stimulated your interest and your passion towards diabetic research?
I mostly my interest developed in diabetes, but broadly cardiometabolic diseases, just because it's so prevalent in the Black community, all of these cardiometabolic diseases. And methodologically, I was interested because cardiometabolic disease thrives off of time. And I love longitudinal research. That's kind of just guided my path further into life course cardiometabolic research.
Thank you. Thank you. Same for you, Tiffany. Same question.
Yeah, when I came into graduate school, I was really interested in processes and how systems work together in order to pull off these biological feats that the body does, like second by second basis. And I wanted to be in a spot in which I could really think of things in a more holistic human physiology sort of way, not just model systems as well. And so I thought diabetes was that really good meld of all those things, the physiology part of things, so the whole body, how that works together, and then also that human impact as well.
And I think it's definitely true to speak about that human impact. We see that it has such an impact on many people's lives, those who may be living with diabetes, but also carers for people who have diabetes as well. There's a big impact, and it's social as much as physiological as well, which you touched on right there. So if we actually go on, like I said, we have a breadth of knowledge and a breadth of understanding on the screen right now. And I actually want to ask a question. Why do you think it's important that we have Black researchers within the field of diabetes, or who are just focusing on this cause? I'll go to you, Tiffany, first.
Yeah, a couple of the other panelists mentioned as well that it's such a disease that is prevalent in the Black community. And that's rooted in maybe some biology, but also the systems in which our community has to deal with and the racism that comes with that. And so I think it's really important for people who are suffering from these sorts of diseases to be represented in who researches them and who also like gets that information out there so people can relate to them as well. And I think it's really important to be there in the room when people are making these broad generalizations about biology, that you make sure you're considering other individuals in a broader base than just kind of a whitewashed research that we've had for a really long time.
Yeah, I completely agree. And what about you, Sarah?
For me, I can draw from my own personal experience. For example, like with my current endocrinologist, whenever I go for like my routine checkups, when it comes to being told my glycated hemoglobin, my HbA1c, he notified me that the current test is not accurate for Black people. And so to essentially take it as a guiding tool, but it's not something to be taken as exact. So it made me wonder that even though they know this issue, they haven't ventured out to like find a more like accurate like tool. So right there is an example of why it's important to have Black researchers within this field, because there are issues that are there, but they're not being sort of taken up in order to find like a solution for it. So yeah.
Yeah, I completely agree. We see it constantly be revealed throughout the news, and when you pay attention to science now, that there are so many things that should have been developed, and you think it's so easy to see. How have we not seen that already? For example, when they're talking about the oxygen in the blood, and it's not being an accurate representation of how much oxygen you have in your blood, and linking back to a lot of deaths that may have happened in COVID. You think, but how did we miss something which it seems so obvious once it's been revealed? But like you said, it reveals the importance to have these researchers who will see that as something important to look at. Gabrielle, I want to come to you with the same question. Why is it important to have Black researchers?
Yeah, I think it's important that we're in the room to ask the questions that haven't been asked yet, right? And we're already so intimate with that information because we see it in our communities, we see it in our families. So I think, of course, we're going to approach the science of it, but it's also important that we address what social determinants of health also impact diabetes outcomes and other cardiometabolic outcomes.
Yeah.
And make sure those questions are asked.
Exactly. I like the intimacy. You mentioned that we have this intimate relationship with it. You come into it with a different perspective, than your counter mates may do as well. Sarah, I hope you don't mind me asking this question. So I know you said that you have type 1 diabetes. Am I
Mhm.
correct? Yeah.
Yeah.
So how do you feel as a person who's now doing better in research and reading around things, as you gain more knowledge, do you feel a bit more empowered now that you have secured some knowledge for yourself in this area?
I mean, I've just started off my journey, but it's definitely exciting to know that I'm venturing out to learn and educate myself, not just for the sake of hoping to make a good quality thesis at the end of my academic year, but also to be able to apply like what I've learned. But it also gives me kind of a heavy heart because I know others within my situation, there's still a lack of like knowledge in that area because again, this stemmed from me asking my doctors several questions and they just didn't have the answer to them. And the main reason actually why I chose to focus on working memory, I had initially wanted to focus on the effect of stress triggering hyperglycemia, again, stemming from my own personal experience, because when it comes to being a student and around exam time, that's really the time where stress is just a factor that's always there. So always experiencing like fluctuations around there, and also struggling with sort of like processing information around that time. Those were like the main reasons as to why I wanted to find out like the link between those factors. But yeah, it's definitely empowering as well.
Yeah, thank you very much. And I actually believe that it is important for us to be able to educate or share the knowledge that we have so that others can feel
Yeah.
that same empowerment for themselves as well. And I think that takes us on very nicely into our next question that we have here. It says, do you think that there is a disconnect between academia and the Black community in terms of relaying scientific information? We'll,
Is that still
we'll
me
go,
or?
we'll go with, well, we could go with you first.
Okay. Yes, I do, because but I think like platforms like this are basically forming the bridge between those who are in academia and industry, and then those who need to hear the information, because we're coming to them by using these social media platforms, because the only other way the information is solely in papers, and the vast majority of people are not reading papers in their free time to gain knowledge or even know how to decipher the information in papers. So I think the more we do these kind of events, the more we bring a table and where we're bringing together the people who are researching and then those who are affected by it, but also those who aren't. So people are just like empowered with knowledge. The less this will be an issue, in my opinion.
Thank you. Tiffany, what do you think?
Yeah, I feel like, as you're saying, both camps, academia and the Black community, feel very siloed from one another. In that academia, we get a lot of training in how to communicate really well to other scientists. And so that's in papers and our presentations. But we need to also be able to speak to people outside of the walls of the ivory tower. And so that means when we go home, can we tell our Black counterparts, our family, about the research that we do? And can we do that in an accessible and appropriate way in which we're telling the truth about the research we see and the gaps we see in our research, but also making people feel like they can come and sit at the table as well and understand what we're saying.
Yeah, I completely agree with you. Sometimes I have to check myself as well when it comes to these points. You are trained or you put yourself in a bubble of your research and these big words that you can relay to, and the only people who are going to understand are other people in your field. And you're not trained to break down these words and communicate them to your community, to your family members, where this research really needs to reach and get home so that they could feel this empowerment that we were talking about earlier. So sometimes I would say I'm researching diabetic cardiomyopathy, and it's like, okay, but what is cardiomyopathy is a word that's thrown people off straight away. What you're just saying that word, or they'd ask you more, you just think, oh, I can't be bothered today to explain. But then I have to double check myself and wait, actually, your reasoning for going into this, don't forget that. And it's important that you have this knowledge to be able to break that down now. And that's a skill I definitely agree that we have to develop on and increase to try and relay our information in a layperson's terms. Gabrielle, what do you think?
Yeah, I was going to say I completely agree with what Tiffany just said, that we are trained to speak to other scientists. We're trained to talk to people who are exactly in our field, right? Um, so especially, I mean, not just with diabetes, but with all disease, all health conditions, um, we scientists got to figure out how to do science communication way better. I like where social media is going right now with health science communication and creating tutorials. And I just saw AJE do, you can do a 1 minute video of your research abstract, which I thought was brilliant. So I think that is a good wave to go on. I also think we as scientists need to communicate better with people who practice, communicate better with physicians, because they are seeing the patients, right? They are relaying the research to the patient in person. And we don't do that well. We tell people, hey, go read the articles, go read the papers and figure it out and relay all this heavy information to your patient. Um, so we need to have better communication with physicians so they are better able to communicate with their patients.
I completely agree. Thank you so much for sharing that. I want to take you on to a paper that I found in 2017 and just tell you a bit of the findings that it was saying. So, as we know, some people generally just feel, when I speak to people, it's who maybe they don't have as much knowledge of diabetes, but they live with diabetes. They are aware of it in a very different way as well, right? But sometimes people feel as though they have no hope for themselves. And we hear all these things of genetic risk factors, and it make a lot of people feel like there's no hope, but I'm gonna get it anyways. So I'm just gonna continue because I'm destined to get diabetes at the end. And a lot of people I've heard have said that same line to me, it's destined, it's in your genes, you're gonna get it, right? That's based on their genetic risk factors. But recently there's been a lot of growing body of evidence that would suggest that, there's not really a difference between the white and the black person in terms of genetic risk factors. And I think a 2017 study, initially, the data was showing that Black people had a significantly increased risk of developing type 2 diabetes. However, when the researchers had taken into account neighborhood-related, psychosocial, socioeconomic, and behavioral risk factors, that disparity was no longer there. What do you think about that? This research that's coming out now. What do you think? I'll start with you, Tiffany.
Yeah, I think that research more than that coming out really highlights the situation that we're in. I feel like a lot of people want to put blame onto, oh, it's just genetics. It's like nothing we doing. It's nothing, I don't know, industries and other like food industries or anything are doing. It's just genetics. We can't do anything about it. It's going to happen. And I think that helps to allow people to step back and really see it's the environments in which people are contributing to, be that you live in a neighborhood that doesn't really have the best like grocery stores or like food deserts. And so how can we fix these broken issues that allow us to step away from, oh, we don't need to think about it. It's just genetics. It's not your fault, not anyone's fault. We can't fix it. But it really gives people back the responsibility of, okay, maybe some medical systems need to change. Maybe some industries need to change in order to really help people not feel that they can just not think about this issue anymore.
Mm-hmm. I completely agree. What about you, Gabrielle?
Yeah, this is a hot topic right now, just in all of research. I think it's important that we consider all risk factors related to diabetes. I think it's very easy to blame things on genetics, but also let's think about what people say when they say like blackness is associated with diabetes. That sounds strange, right?
Mm,
Like because you're born black, you're born like already at a default. And that sounds weird.
yeah,
Um, and I think it's important that we think about um, all the social determinants of health that impact or increase our risk for diabetes and other disease.
mhm,
So, um, what do the neighborhoods that Black people, what do they look like? Do they have access to sidewalks so they can get active physical activity? Are their
mm,
neighborhoods safe so that they can go outside? Do they have great access to healthcare? The
mm.
healthcare that they do receive, is it adequate? Is it sufficient? Are they able to ask the questions that they need to ask? Do they even know what questions to ask? Right? Um, do they have access to healthy food? All of those things are important and they are not the result of being Black. They're the result of the social systems and networks that we live in.
That's correct. I completely agree. And I like the point you made. Do they even know the questions to ask? I think
Mhm.
many a times it's, you're living without the awareness that something is wrong. And that, the issues around me are coming upon me and actually resulting in a higher risk for me developing a disease. If you're unaware of that, will you even know the question to ask? Because it's not a question that's coming to your head to even think about. And so for a lot of people, the first thing they think here and they recognize is genetics or uh, you are the problem. So you don't have a question to ask anybody because it seems as though everything is upon yourself. Um, Sarah, what do you think?
Yeah, I agree with what both the ladies have said. By solely saying that it's just genetics, it's almost as if you've accepted your fate. So you've relinquished any responsibility to put forth any effort to give yourself a fighting chance to prevent actually uh, getting type 2 diabetes. Because obesity is like on the rise. So those two go hand in hand. And with obesity, there's a lot that you can do in order to prevent it, even though you're genetically predisposed to being bigger. So I think that's a positive that that paper has come out because hopefully it will start to get people to think, okay, what can I do to give myself a fighting chance to not get type 2 diabetes.
Thank you very much. And you're actually leading us on, Sarah, very well. Um, and on that point of obesity and type 2 diabetes, and we know that that is something that's on the rise and that they go hand in hand together. And as obesity is increasing in the general population and in younger people, we're seeing more younger people become obese. We're also seeing diabetes, type 2 diabetes occurring in younger people too, a lot more. And so there has to be this thing of what can we do? And that takes us to the next question of what control do people have over their own health in regards to diabetes? What can people do? What do you think, Sarah?
Yeah, this question, right? So with diabetes, there are a lot of factors that are just outside of your control, whether it's hormonal shifts that affect your glycemia. But in theory, yes, you do have a lot of control, a lot of things that you can do. But when it comes to diagnosis and how you're taught to manage it, an area that seems to be neglected on is the psychological impact of the disease. And the issue with that is because it is chronic in nature, a lot of people tend to go through either burnout related to diabetes or stress, as I mentioned, for my situation, anxiety, or even like depressive episodes. So when it comes to, you can relay the information that's being found to the community, but if you're dealing with an individual that is going through burnout related to diabetes, they're not going to manage the illness well the way they need to. So it's like the information hasn't helped in order to prevent people from developing complications. So that's why I think that area needs to take a forefront and become one of the main pillars, because right now the focus is taking insulin, physical activity, and a balanced diet. And the psychological impact of it is just either put on the side as an option, but not put at the forefront with all the other three pillars. So that affects the control that someone actually has, at least that they perceive to have, is what I mean.
Thank you very much. Same question for you, Gabrielle. What do you think is what control do people have?
I think people have some control. There's genetics to contend with, and I don't want to shun genetics. Genetics is a real thing. And then there's some environmental, or there's some health behavioral things that, you can do. And Sarah alluded to, which is kind of the bulk of my research. So engaging in 150 minutes of moderate to vigorous physical activity if you're an adult each week, reducing sedentary behaviors, and eating a healthy diet. Prevention is really where it's at with cardiometabolic diseases, because once you get one, they're like friends, and someone else wants to join the party. Like diabetes shows up, and like high cholesterol is like, hey, I want to hang too. And like hypertension is like, hey, can I hang too? So preventing disease is like the best work, which is why like creating healthy behaviors in young children is where you really want to put your most effort. But in terms of control, I think we should start prevention efforts early. And then things outside of your control, along with genetics, would be like, again, and I will continue to say it, is social determinants of health, and our systems of healthcare that we collectively need to work on and make better.
Yeah, I agree. There are many things that we should actually work on preventing rather than cure, and it's a big thing. I think I've always been an advocate for that. Work before it happens, put the effort in before something happens. I remember thinking back to an undergraduate lecture, and they were talking about cardiovascular diseases in general, but a lot of them, they were saying, the doctor was saying that the issue actually began from the baby, or from the 2-year-old child who started to eat food. And they saw that these buildup of things started happening so young that, it was so hard at now 45, 50 to try and tackle something that was actually building up from so young. And so these habits that for future parents and all these things coming up is something that we have to implement from young, very young, to just have a healthy lifestyle. And I completely agree with you on that point there.
Yeah. And we know this, right? We know that even though like the clinical presentation of cardiovascular diseases or cardiometabolic diseases, like they appear in middle age, that process starts as early as like 6, based on data from the Bogalusa study. They begin to see like fatty streaks in heart muscle, right? So that's why cardiometabolic diseases in general, they're slow growing, they thrive over time. So creating healthy behaviors, again, to not try to get into victim blaming, but creating healthy behaviors, creating healthy physical activity behaviors and healthy diets, that's important of what we can control in the process.
Yeah, thank you very much. Tiffany, over to you.
Yeah, I really appreciate both of what the other panelists put out there as well. And then I'd also add cultivating communities in which we can support both the psychosocial side of things, in that there's been some studies that have come out that if you can even meet with a community group at even a local like YMCA or things that have these systems in place, and just get and that can check on your mental health and how are you doing with your nutrition this week. Help one feel like they have control over this chronic disease. Health aspect is really important. So let's say you can't get that support at home. Maybe not everyone knows what's going on, but if you can go somewhere external and get some help that way, that would be really great. So if we can have more knowledge of the resources that communities already have, go into communities and help people already there, I think would be really important.
Yeah, thank you very much. I want to take this moment to just remind those who are joining us on Twitter, on Facebook, on YouTube, wherever you are, even those in this call with us at the moment, that feel free to ask questions, send in questions. We're here to answer what questions we can answer and just get some things discussed and tackled. Whilst you are thinking, I'm going to throw a challenge to our panelists right now. We've been speaking about communicating information and how it's very important to be able to communicate our research and our work in a way that people can understand. So I'm going to give you 3 minutes each, max, to communicate the work that you're doing in a way that everyone can understand, right? I think, because I just threw it to you, I'll give you 30 seconds to think and just get that together. But then I'm going to start with you, Sarah. I'm going to start with you on communicate your work.
Okay, so I am focusing on how high blood sugar levels negatively affects your cognition. And I'm specifically focusing on the domain of working memory, which is essentially how you process information and how you're able to reach back to the information they have in your brain. And it's with a simple working memory tasks. So the NBAC task, the forward, backward Corsi task, and the digit span task. And it's a single case study. So I'm actually the main participant within my study. And it will be carried out in a given time period during normal glycemic episodes and also hyperglycemic episodes in order to see the change of the two. And I'll also be looking at shifts in mood from when normal and when hyper.
Thank you. You did well, you did well. I mean, you did well. I'm going to go to Tiffany next.
Yeah, so I'm in the Powers Brasova research group at Vanderbilt University. And we work on a lot of different facets of diabetes and then also characterizing the non-diabetic pancreas as well. Because surprisingly, we know very little in the grand scheme of things about both cases, the disease state. And so my niche in all of that is really understanding the communication mechanisms within the pancreas, because we take a pancreas diseases. And so I work on these small little islands in the pancreas called islets, regulate your blood glucose after you eat a meal and between meals. And so I work on how does the body put in inputs to those little islands in your pancreas in order to alter the amount and frequency by which they put out those hormones to control your blood glucose. And so I look at how the brain connects to the pancreas, how the vessels from your heart connect to your pancreas, and then also internally, what are some certain substances such as like nucleotides, like ATP, that people think of powering the cell and all of that, how that also affects how hormones are secreted from those.
Thank you very much, Tiffany. Thank you. Gabrielle, your turn.
Sure. So right now, as I'm wrapping up my dissertation, I am I'm looking at longitudinal and isotemporal associations between physical activity and sedentary behavior on several cardiometabolic outcomes. And as related to diabetes, one of them would be fasting glucose. So longitudinal, I'm specifically looking at a largely Hispanic population, and I'm looking in preschool age children. And that research kind of spawned because the recent 2018 physical activity guidelines suggested 3 hours of activity in any physical activity domain. And that recommendation was given off of very limited longitudinal research in preschool age children. So I wanted to answer the questions. One, is that a valid recommendation of 3 hours in any domain? Would we see any beneficial effect on obesity and several other cardiometabolic risk factors? And two, the isotemporal analyses. If I could replace, theoretically, if I could replace time spent in a poor domain like sedentary behavior with time spent in a healthy domain like moderate to vigorous physical activity, let's say I replace 10 minutes of that time, what then would be the effect on the outcome? That changes the public health messaging because we can advocate for reduction of sedentary behaviors better, but we can also give possible credence to other domains of activity, like light physical activity, which is where most people spend their time. So I'm wrapping up that work now.
Thank you very much. I think what you three have shown is that, yeah, it is possible to relay the work that you do and the information that you do, but it's also important that you get into spaces where you can do that and that you communicate with people who want to hear and to use the skill very wisely. We have a question about the structural issues related to diabetes treatment and prevention. But the question has not fully come in yet, but there is a question coming about the structural issues related to diabetes treatment and prevention. Deborah is going to ask.
Yes, I did have a question about diabetes treatment and diabetes prevention, because we do talk a lot about stuff that are outside of our control. We're looking at the genetics part of it, and things that are within our control, and we are looking at what we eat, how we exercise, and so forth. But I think one thing that what this pandemic has really shown, like across the diaspora in the United States, outside of the United States, in the UK, or even on the African continent, is the very large importance of these huge structural issues that are determining who is able to afford food, who is able to go to the gym, who is able to be understood when they're asking for treatment or even believed, and the kind of treatments that are available or the kind of prevention programs that are available to some people. Because it's like even when I'm looking at myself as a Black person, there's this privilege. There is this privilege of education, and also having a good good insurance. So when I go to my doctor, when I can see my doctor regularly, and we can talk about stuff that are making my health better. But if you don't have insurance, if you don't have that kind of privilege, if you don't have the right ways to say it. And if you are a Black woman or Black person in America, and we all know, or most of us know, hopefully, know what it means to be Black in the healthcare system. Can you kind of discuss a little bit more about these structural issues that are basically, that are even controlling things that we can control ourselves to prevent and to treat or to manage diabetes?
Yeah, anybody want to respond or answer?
Good, go right ahead. I really love everything that you said, and also that you highlighted that during this COVID era, I feel like a lot of people got to the kind of the end of their rope of it's been this way for a long time and it doesn't have to be this way. It can be better. And COVID really, it targeted the individual, or it hurt the individuals the most who don't have as many resources as other people because of these different social determinants that we're talking about here today. And so one thing I found within this pandemic and this era that we're entering into is that we need advocates for us. And so we know in the healthcare system, the way in which Black individuals are seen and heard and unheard by the medical institutions is that things can be happening that are lived experiences, but there's no one there to really listen and understand. And so that negatively affects treatment. And so being able to have either advocates with you at appointments, if you're able to do that, because there's always power in numbers. And then also, can hospital institutions make advocates available? So if someone's really uncomfortable speaking with their medical professional, can you make it easier to switch and it be okay to get another opinion, which is always okay to get another opinion? Or can you have people in that office step into the room with you, maybe that even look like you, that can help you communicate what you need to your physician or help you exit a situation that's not helping you medically? So thank you for that question.
Yeah, I think Gabrielle, you wanted to say something.
Yeah, I think to me, the nail on the head. I think patient advocacy is important. I actually really like the point you brought up about getting a patient advocate from the hospital if you don't have like the resources around you in your close-knit circle. But I think this is going to take an overhaul, like a large overhaul of how we do science. One, how we do science and how we look at it, or that we look at it in a broader lens. We've kind of done science from a very white lens, and we need to expand that and make sure we're inclusive when we ask our research questions. I think we need to do better with public health translation just as a whole. So once we do all the big studies and we find the answers, how do we really translate that into our communities? How do we create effective practice guidelines? And how do we create effective policies that will truly impact and benefit our communities? So there are still a lot of steps, I think, in a lot of places that need to happen, but we got to figure out where to start.
Yeah, I agree. There are so many things to actually tackle that we have to address in order to overcome what Deborah has said rightly. From education itself, the system, I know that from COVID and all the events that have been happening, a lot of institutions are pushing this decolonizing the curriculum, especially the medical curriculum and the science curriculum in general, that we begin to broaden that knowledge that it's surprising was not there or was not taught to the previous doctors who are currently treating us in this moment. I think that ranges not just within cardiometabolic diseases, but all kind of things, from pain and recognizing pain, which has been a big topic as well. we could see that there are problems that even as you go to a healthcare system for help, you don't feel confident enough that you're actually going to receive the best help. And so I love what you said, Tiffany, to not be afraid to also get the second opinion, or to just do that further investigation for yourself. And this is actually all relaying back to what we were saying earlier, this sort of feeling confident in yourself, that despite not maybe having the depth of knowledge, you still have some sort of standing and word for your own health. And feeling that you can actually have a say for your own health is very important. If we look at a lot of the institutions, it does seem as though you've been kind of pulled back or stripped back from your own health and given it over to others to deal with. But what we're seeing here and recognizing is that actually you need that confidence and that strength to actually take charge for your own health. So going and getting that second opinion. And that's just one area, which Gabrielle rightly said, there's so many other areas that we actually have to tackle to get to that point of breaking down these structural issues and diabetes prevention and treatment. Again, if there's any other questions, if it's on Twitter, feel free to comment them. We will get them answered over here right now. Deborah, did that answer your question? Okay.
Yes, it is. Thank you.
Yeah, okay. There is something here. As you, all three of you are currently on a journey of research. Gabrielle's talking about writing her dissertation at the moment. And Sarah's also writing as well. And you've just started your research as well, right, Sarah?
Yeah.
So as we are, all of you have gone through some element of research. What has shocked you or just left you in awe so far through your research journey? What have you found that, or read or seen that has just left you in a bit of a state of, wow, I did not know that, or I'm surprised? Yeah, go on, Sarah.
For me, it was just the lack of the literature gap just in this area. There was a lot of literature to do with cognitive impairment when it's to do with hypoglycemia, low blood sugar, but there was a significant literature gap when it came to hyperglycemia, because there's the long-term component with that. So venturing into that area and not having a lot of background sort of literature to work on was, it made for an interesting journey, and definitely developed my curiosity in the way I'm sort of like formulating how my study is going to be like.
Thank you very much. Gabrielle?
I have two that have kind of left me like, one is how unaware people are. I think in research, we live in this silo of like, we're reading constantly, we're gathering, we're processing, and how unaware lay people are of their health status, and just healthcare recommendations and guidelines in general. That has been such a wow moment for me. I mean, just thinking about diabetes and broadly, so many people have pre-diabetes. Like, we're talking about diabetes, but pre-diabetes is wow. And only 13% of Americans know they have pre-diabetes, but like 90 million Americans have pre-diabetes. Wow. People are just wildly unaware. And I think that's scary. And the second thing is something methodological, but how things were defined, and how things have been defined, and we still use those definitions. Something big in my research were the obesity reference standards for children, and how there are some methodological errors that kind of lump a whole bunch of people at one extreme. And that was just based off poor definitions and poor methods, but we still use that standard, right?
Yeah.
40 years later. So yeah, I've been like, we want to do all the science and the big things, but it's much simpler questions that I have now.
Thank you very much. Tiffany?
Yeah, something also along those lines that surprised me was how I, as a diabetes researcher, innately the types of things like your body needs in order to control your glucose homeostasis, and how certain processes are off or perturbed in type 1 and type 2 diabetes. But then that gap between how people are receiving treatment, and so are they getting the best treatment for the type of diabetes that they have? Because even though we categories within diabetes that we're understanding more and more. And so if you have the access, or your doctor does, to know these different nuances in diabetes, then you can get better personalized care. But because some people don't have that kind of access to either medical centers, drugs, and things are really expensive, that people have that treatment gap, which is innately, as a scientist, I think is really unfair, because I see that one thing can be really good for a certain type of diabetes. And the philanthropic person in me wants people to get their best medical care that they can get.
Thank you very much. We have another question now. I'm going to see if we could actually get them to ask it. If not, I'll just read it out for you. Okay, I'll read the question. It says, what advice would you give someone wanting to pursue a career in diabetic research? What advice would you give someone wanting to pursue a career in diabetic research? I'm going to start with you, Tiffany.
Yeah, I'd say the first thing I think of is I try to think about me when I came into grad school. What advice would I give myself? I'd probably give myself, and who's ever asking me this question and needs advice, what do you feel that you can add? And one, that's really important for the field, and don't let other people tell you that you don't have that sort of value, even though you're new to a certain field. And then also that it's going to be probably most of the time, but when it does work, think of that impact that you can have on the field, on science, and on people you may or may not know that have diabetes. So stick to the good things when things aren't going as good, and then know that you can add value.
Thank you very much. And I could definitely agree with the point of things will not work all the time. Sarah, what about you?
Yeah, I agree with what she said. Just finding like your area, what your unique contribution is going to be, because it's such a broad field and you can't solve all of the issues. So just finding your focus and honing in on that, and doing your best to be able to produce like quality research in that area. I think that's a good one, yeah.
For sure. Finding that area of interest and honing down on it, because like you said, it's huge, it's so complex, and a lot of the times that is why some things don't work in the research too, because it's such a complex thing that's going on. There's so much happening that you can't just eliminate everything else, but honing down on something, because you can't, essentially, it's not you who's going to be the person who just completely eradicates it all, but we're all working together on this issue here. Yeah. Gabrielle.
I would say early in your career, in your academic career, be open. Be as open as possible. One, cardiometabolic disease as a field is extremely broad, and diabetes alone is broad. It can go a lot of ways. So be extremely open and read as much as you can. And in the reading, you'll find the gap. You'll find the gap in literature. And that's where you can move in. And more often than not, the simplest research question is your most impactful question?
Thank you very much for sharing that. We are coming to the end of our discussion today, sadly. But I have learned so much. This has been extremely insightful for me, and I'm sure it's been insightful for those who are listening on the various platforms. I want to thank Sarah, Gabrielle, and Tiffany for joining us today. Thank you guys so much for sharing the information that you have shared, giving us a bit more of an insight into what it is like to actually be a researcher in diabetes. I want to thank you guys for being honest and open and just being willing to answer some of these difficult questions as well. Thanks to all our viewers for tuning in, and remember that this can be rewatched if you want to go back to it afterwards. All the Black in Cardio events and the talks and discussions, they are recorded, so you can rewatch them again after this has ended, and share it on, because we have learned so much and we've revealed a lot of things here as well. So big thank you to our panelists, and have a good rest of your day or evening or morning or whatever you're going to do now. Thank you very much.
Thank you.